Greetings, my chief.
Step into MedNemo the lab, where mnemonics make med learning vivid. We're culturing clever memory hacks to help you isolate key topics. From vaccinating against forgetfulness to transfusing mnemonic magic, we've got the remedy for med school stress.
Today we are going to be talking about angina pectoris, and I have with me Jacob, who is going to assist me in making this lecture as fun as possible.
Hey, I'm Jacob and I'm going to be helping out with the mnemonics, so get ready to have your minds blown.
Angina comes from the Latin verb angere, meaning to strangle or to choke, while pectoris is derived from the Latin word pectus, meaning chest. What is angina pectoris? Angina pectoris is a type of chest pain or discomfort caused by myocardial ischemia. Myocardial ischemia is a condition characterized by insufficient blood supply to the heart muscle relative to its oxygen demand. Angina is not a disease itself, but a symptom of underlying coronary artery disease. Simply put, angina is your heart complaining like,
"Hey boss, you're making me work too hard, but you're not giving me enough oxygen. So I'm gonna squeeze your chest until you get the message."
Now for the pathophysiology. In angina, the heart's workload increases, meaning its oxygen demand would also increase. Then there is also an increase in preload, which simply means the volume of blood in the ventricles at the end of diastole. Also, there is increase in afterload, which means increase in vascular resistance. Finally, there is also an increase in the force of myocardial contraction.
In all she has said, just use dash to remember the main triggers of angina. D for demand increases. A for arteries narrows, aka atherosclerosis. S for spasm, and H for hypoxia. Don't forget, demand goes up, supply goes down, and pain shows up.
Thank you, Jacob, you're pretty good, but let's see if you have mnemonics for the types of angina. There are 3 types of angina: stable, unstable, and variant or Prinzmetal angina. Stable angina is caused by coronary artery narrowing due to atherosclerosis. Pain is only felt on stress or exertion, meaning it is predictable, and it can be relieved with rest or a biclass of drugs called nitrates. Unstable angina is caused by rupture of an atherosclerotic plaque in a coronary artery, leading to formation of a blood clot that partially or completely blocks blood flow to the heart. It is a warning of impending myocardial infarction. Variant or Prinzmetal angina is caused by coronary artery vasospasm. Unlike in stable angina, patients still feel pain even at rest. In the ECG, it is represented by what we call a transient ST elevation.
The mnemonic for the types of angina is SUV ride. Stable is stress-induced. Unstable is unsafe at rest, and variant is vasospasm with ST elevation.
Let's play a little game of myth versus fact. I will be saying the myth while Jacob says the fact. Ready, let's go. Angina is a disease.
Angina is not a disease but a symptom of underlying heart problems.
Angina is the same as a heart attack.
Angina is what we call a temporary ischemia. It causes no permanent damage.
Angina lasts for hours.
Classic angina lasts minutes. Hours of pain equals myocardial infarction.
All chest pain is angina.
Chest pain has many causes, as example lung disease. Angina is specifically from myocardial ischemia.
Angina pain is always sharp and stabbing.
Angina pain is usually pressure, heaviness, squeezing, or tightness, not sharp.
There are 4 classes of drugs, namely nitrates, beta blockers, calcium channel blockers, and antiplatelets. Nitrates, they are converted to nitric oxide in the vascular smooth muscle. They cause venodilation, thereby decreasing venous return, aka preload, and ultimately myocardial oxygen demand. 2. Coronary artery dilation, which increases oxygen supply, e.g. nitroglycerin, isosorbide dinitrate. Beta blockers, they block the beta-1 receptors in the heart, thereby decreasing heart rate, contractility, blood pressure, and myocardial oxygen demand, e.g. metoprolol, atenolol, propranolol. Calcium channel blockers, they block calcium channels in vascular smooth muscles. This reduces calcium ion influx, afterload, and ultimately myocardial oxygen demand, e.g. amlodipine, nifedipine. Antiplatelets, a typical example is aspirin, which inhibits COX-1 enzyme, thromboxane A2, and prevents platelet aggregation. Until next time, from MedNemo.
Mnemonic-based medicine.